Good evening. Today the videos for the medicine residents who got posted in NEPHRO and regarding those students who are having doubts how to publish a case report or case series for that matter with an example we will show you here. So this is a certificate from International Journal of Academic Advanced Research where we published one case of autosomal dominant polycystic kidney disease. And look at the certificate, it is PubMed indexed. Our medicine PG Bhavya was the first author, and we co-authored this. They have approved it, and it got published also on the website. You can find the article. So not only he, the many previous medicine PGs who have completed NEPHRO, so many images I have asked you to take. Many of you might have those important clinical images in your phone, might not have published because of the doubt how to proceed further. First, let us see what is this case all about. This is a case of ADPCKD. Two patients who got admitted at different point of time with the same common clinical presentation as we expect. On a routine day, if you see the CT images ADPCKD, since you are in nephrology posting, you routinely see these cases. While clicking the photo, you might not understood that this is going to be a case which is publishable, because many medicine PGs ask, sir, what I need some interesting case to publish. Interesting case, some rare syndrome, something like that. See, if you are good in the subject, even a simple case, you can find the important point you want to contribute to research. That probably a consultant will help you in catching the important point. What is the interesting fact over there? So after collecting the photo in this particular patient, what we have found out, those were the family members as such. So they are sisters, and other thing is also very clear. This AD, autosomal dominant polycystic kidney disease, will run in families. Obviously, the sisters are supposed to have this disease and a clinical manifestation. Okay, this is very common. Then how it is publishable? For first thing, towards a case report or case series publication, you have to get what is the gist there, what is the extra information you can give from this particular patient or a particular case. In this example, initially we have clicked the photos. The photos, we will go through the images directly. These were the photos just taken in a normal mobile that we use only in the ward where the view box was there. The images are of CT, only a particular section. This area of the CT film, if you take, there might be 8 to 12 images you can get. And we focused over there. In a particular section, we have taken axial section, and this section we have taken where we focused on a big sized kidney. This side also both the kidneys are very largely dilated. Other interesting fact is the liver is studded with a cyst, and one longitudinal section to show the big size of the kidney. So since you are in a nephrology posting, since you are seeing these kind of cases day in and out, at that particular point you might think this is very common, but once you go out of the nephro posting, the incidence of ADPCKD is around 1 is to 1000, but this much big kidney, the size was around 20 centimeter, is bit rare. And in a female patient, liver cyst, there is a particular gene which was involved. So this is the 3 images that we took on a random day and we kept it aside. In the subsequent week, we got another patient with this almost similar finding. Look at the photos that the postgraduates or we have taken, again with the mobile, again to show the cyst on the big sized kidney. The cysts are present over the liver. There's a big sized kidney which is almost more than 20 centimeters. Again, almost the usual finding in ADPCKD. Then how it is publishable? We got these interesting images. Now you look at the theory. The most common extrarenal site in ADPCKD is liver. But this much big liver size involvement. is associated with a particular gene, and involvement of the liver cyst is an important finding in this patient. Age group. Both the patient presented in this age group of 50 to 60. So we got the image which is in the phone, and we got this particular finding liver is involved. So we asked the postgraduate to write a case report on this. So this I have told to many of you who are watching the video, the medicine PGs, for whom the video was intended. So how to write it? First, you have to align the images like this, which is the most tedious job. मेडिसिन पीजी विल फॉरगेट कि बाद में कर लेंगे कभी होगा नहीं. Just in the Microsoft Word document, transfer your photos from your phone through Gmail, download it in your laptop, arrange in the Microsoft Word document. So half of your work is done. The rest we will guide you how to write it. So the important finding, two random patient, two very good image finding, the clinical importance regarding ADPCKD. So this we want to publish it as a case report. Then once we decided to write a case report, what we have to do? First, after arranging the image, take it, go to a blank page. So what we have to do? We got the image, we arrange it into the Microsoft Word document. Then you have to form an introduction. There should be some gist. What is the gist in this case? There's a case of ADPCKD. Liver cyst has been came in the focus. Both the patient age group are 50 to 60. What is the prognosis in this? What is the gene involved in this? And in patients with the liver cyst, yes, of course, this can also be present in the siblings because of the autosomal dominant form. Both had some subtle variation in the clinical presentation. One presented similar to a UTI, another presented similar to a uremic manifestation. So the manifestation was somewhat different. What was the outcome? How we managed? So this is how we are. This is the gist of this case. So ADPCKD, this we are going to bring it. So introduction. What are the things you have to study regarding ADPCKD? If not, probably once you arrange the image, rest as a consultant, I will guide you out. So introduction regarding ADPCKD, how common it is, why we are publishing this case. Regarding subsequently after the introduction, you have to give regarding the case background. What was the presentation? There will be a particular format. You can discuss each case separately as we did in this publication, or you can discuss both the cases together in your own style. Then once you write the background, you have to attach the important clinical images with the particular labeling, and subsequently you have to discuss, which is nothing but adding the theory component. You can take it from the textbook or you can take it from the previous review article where you have to add the reference. You have to put a particular number and you have to add the particular reference from where you took it. Preferably, this initial three part can be in your own sentence, like how this patient came. Like you can use your own English. There won't be any plagiarism by that way. And if you, in the discussion, even if you use, since we are using the reference, we are going to say this is where that information is taken from. So after that, you have to write the conclusion. So this is all regarding this case, then ethical committee clearance that we might have obtained for the thesis, or particularly for this case, we might have obtained, that you have to attach everything in the Microsoft Word document. Then you have to select one journal, preferably a PubMed indexed one. And if you go there, there was already a previous video which was uploaded, how to go to the site, how to search the author login area, and how to submit, how to see number of words and all. So once you find that, there will be a word limit, like 300 words should be there in the abstract, total number of pictures allowed, total number of images allowed. For a case report, it is usually one or two images, one table, around 1500 words, something like that. Once you submit this, the reviewer will see and revert back to you what are the advantages, the merits and demerits of this case report. Not all journals will accept, they might deny, then you have to find another journal. So this case, once we submitted, they directly accepted this publication. See, whenever the image is good, especially the clinical image, usually the journal will accept for publication. That is why I always tell the postgraduates to take a pic without any shadow, in a good orientation. Many a times students in a hurry ठीक है राउंड्स चल रहे हैं, थोड़ा बिना लाइट का भी ऐसे हाथ में पकड़ के फोटो खींच लेते हैं. नो, you have to keep it in the view box. Make sure the view box is well lit, and you have to just a minute.